broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar on emotional considerations for pediatric transplant families. We're glad that you're joining us today. My name is Gina Petty, and I'm the Director of Family Support and Outreach at the Children's Cardiomyopathy Foundation. We're glad to be partnering today with Transplant Families on our webinar in support of National Pediatric Transplant Week. Just a few housekeeping notes before we get started. If at any point during the presentation you have any technical issues, you can type your concern in your chat window. If you have audio issues, you should be able to switch between using your computer speakers to using a phone number to call in to connect with the audio if you need to. In order to provide a high quality session today and avoid background noise, all attendees are in listen-only mode. Questions are encouraged and welcome during the presentation. You can submit your questions via the question box, which is located on your webinar control panel, and we'll be taking questions at the conclusion of the talk. Now I'd like to introduce Melissa McQueen, who is the founder and executive director of Transplant Families. Thanks so much for your partnership, Melissa, and welcome.
Hi, Gina, and thank you so much for the introduction. Transplant Families was founded in the hope to support, educate, and inspire pediatric transplant families for all solid organ and bone marrow transplants. We are happy to celebrate with Children's Cardiomyopathy Foundation to celebrate National Pediatric Transplant Week. Proud to work with CCF and all the support organizations, hospitals, medical professionals, and many others that make pediatric transplant a much easier journey. Every day after transplant is truly a gift for us, and we thank you all for that. It is now my privilege to introduce Dr. Melissa Cusino, who is the attending psychologist to the pediatric heart and kidney transplant programs at C.S. Mott Children's Hospital at the University of Michigan. She works collaboratively with all members of the transplant teams to promote coping, foster quality of life, and address transplant-related challenges, such as adherence to treatment regimen, anxiety-related procedures and treatments, and transition to adult care. Dr. Cusino's clinically informed research includes the study of patient and family adjustment, adherence, and transition readiness in pediatric solid organ transplantation and healthcare communication and decision-making in pediatric medicine. Her program of research is currently funded by 2 grants from the National Institute of Health. She has received nearly $1 million in research grant funding in the past 2 years to study psychosocial health, and it correlates to among pediatric population with advanced organ disease. As such, Dr. Cusino speaks nationally and internationally on the topic and is actively involved in a number of scientific and foundational organizations in pediatric organ failure and transplant. Dr. Cusino, we are so thankful for you to join us today.
Thank you, Melissa, and thank you, Gina, for the kind introduction. I'm really honored to be a part of this special Pediatric Transplant Week. Many thanks to the Children's Cardiomyopathy Foundation and Transplant Families for all of your energy and effort to just bring awareness to this special week, share information. It's just been tremendous to see what you are doing. So thank you, and thank you for hosting this webinar. I have no financial disclosures or industry relationships to report, but I do want to give a Twitter shout out. So for parents and caregivers who may not be actively involved on Twitter, I really encourage you to think about it. I'm on Twitter. Of course, CCF and Transplant Families are also on Twitter, but I have found it to be a wonderful place to go for breaking research, updates on conference talks. Many of your cardiologists, your transplant physicians, surgeons are on Twitter, and you can really get information just right there. And so if you're not there yet, please join and follow us. We love to connect with our patients and families through Twitter. I do want to also acknowledge the organizations that fund the research that we've been able to do on psychosocial factors in pediatric transplantation, specifically the National Institute of Health, the International Society for Heart and Lung Transplantation, Enduring Hearts, and my own institute, Michigan Medicine, and specifically our University of Michigan Transplant Center. So today I want to give an outline of what we're going to be covering. We will briefly review the literature on emotional and behavioral health outcomes for patients, but also for parents and families who are pre-transplant or post-transplant. From what I understand, we have parents and caregivers who are in all phases of this roller coaster of a transplant process. And so we'll be speaking across the continuum of transplant today, and hopefully touching on all organ groups as well. We're really going to just kind of do a snapshot of what the research has shown, because I want to spend most of our time talking about tips for parents and caregivers that you can use at home to help your child, to help your teenager cope with the transplant process, also for your own mental health care. So I will be sharing a lot of strategies and ideas, and then of course saving time for the important questions and discussions that will follow. But first, I want to put today's webinar in context. So I often say this quote to my patients and families and many of the colleagues that I work with. Most often, I find that one is not responding abnormally to a normal life experience, but rather responding normally to an abnormal life experience. And so, you know, I think that is often when people hear, oh, we want you to meet with our psychologist and we really think you need to talk to them. Of course, people are like, oh my goodness, what are they going to think? What are they going to worry about? There's so much stigma often associated with mental health care. And I tell you, I expect families, I expect our young people to be scared, to be sad, to be distressed, to be angry, to have all of those feelings. Those are normal responses to an abnormal experience of transplantation. And so while I'm going to be talking about rates of mental health conditions and how we cope, I just want everyone to take a deep breath and know that the feelings that you or your child may be experiencing are often very within normal limits given the stressors that you are facing. All right, so quickly looking at data from pre-transplant, I want to start by putting this literature into consideration. So overall, there has been very little research on mental and behavioral health outcomes in pediatric transplantation. When we look at the adult literature, for example, or even the medical literature, and this is for a number of reasons. Our pediatric transplant populations are small in numbers. We have various transplant types. And so when we're looking to do research studies, unless we're able to go and include other centers, which can be challenging to do and costly to do, we're making conclusions often based on very small numbers of patients. And so overall, this is an area where we have limited research, where we need to do much more work. And I think that there's a lot of energy and time being invested into that. But I want you to know that as we look at some of the data today. Also, many factors can impact pre-transplant emotional and behavioral health. So I'm going to be giving a sweeping overview, but certainly a child's physical health status, so how, where they are in terms of transplant listing, hospital versus out of hospital, their age, the family functioning, and any pre-acute illness, mental health can also impact their pre-transplant coping. And then I think it's also really important to acknowledge that symptoms of mental health problems overlap significantly with symptoms of advanced organ disease. So the measures that we use to measure depression, for example, or anxiety, for example, are asking about symptoms that we are also looking at or noticing in our advanced heart disease patients. So, you know, fatigue, changes in appetite, changes in sleep, not wanting to do favorite or fun activities. And so this can be complicated for patients, parents, caregivers, and healthcare providers when we are trying to determine, well, is this because the heart is getting sicker, or because the kidneys are getting sicker, or is this because the child is feeling more depressed or more anxious, or, you know, maybe a combination of both. And so I want to also just acknowledge that we certainly recognize these things overlap, and that's why when we're doing this type of research, we have to be really sensitive to the measures and what they're asking. So looking at the data, we have had many more studies in heart and kidney pre-transplant than we have in liver and lung. And so I've summarized those, although I would suspect liver and lung pre-transplant are really quite similar. So across the pre-heart transplant group, we see about 20 to 25% of our youth patients, so child and adolescent patients, present with clinically significant symptoms of depression, anxiety, or adjustment reactions. Now, this number may seem high, but I want to also put this in context. 1 in 5 children, so about 20% of children throughout the US are going to meet criteria for a mental health condition during childhood. And so these rates that we're seeing among our pre-heart transplant population are really pretty consistent with the national average. These are still high rates. This is 1 in 4 of our pre-transplant patients. And so it's not something that we can ignore just because it's what we see in our general population. But I want you to understand that this is what you may also see, kind of similar rates among healthy siblings or among healthy family members. We do see higher rates, approximately 50% of clinically significant depression, anxiety, and adjustment reactions in pre-kidney transplant patients. And this is specifically among those on dialysis, and even more specifically those among who are on hemodialysis. Of course, dialysis comes with a lot of burdens for patients and families, 3 to 4 times a week dialysis treatment, diet restrictions, etc. And so we are seeing a bit of higher rates among that population. So why? I mean, you as parents and caregivers probably see many of these things, but understandable reasons why our young people may be experiencing sadness and anxiety and adjustment issues. There's certainly social isolation that comes in the pre-transplant phase, whether they're waiting inpatient for a donor organ or the dialysis treatment we talked about, out of school due to frequent appointments or illnesses. Peer and social interactions are such an important part of childhood and adolescence. And so that is one thing our young people are facing. I mentioned restrictions, but pre-transplant, oftentimes kids have diet restrictions, fluid restrictions, activity restrictions, no longer able to doing that favorite sport. And what comes up probably most commonly in my work is no longer being able to swim, you know, because of a port or a physical restriction. And those are some of the joys of childhood that young people are limited from pre-transplant. Changes in family and parent functioning, as much as we may try to minimize those changes, of course they're happening, you know, so, you know, there may be more conflict in the home, more stress in the home, mom or dad is not around as much, sibling may be acting out more because mom or dad is in the hospital more often, and so this can certainly impact our young people. The waiting, the unpredictability of transplant, loss of control, independence, and privacy. This is important across all developmental stages of childhood and adolescence, and certainly something they face. And then there's just the realities of pre-transplant pokes, labs, surgeries, biopsies, caths, frequent medications, changes in medications that have side effects. And so this is where, you know, that normally responding to the abnormal is where I always say to my patients and families, I expect you to be upset about this. I expect you to not love any of this, right? But we're going to focus most of our time is that we can still hopefully help around some of these issues. And some not so breaking news for parents and caregivers tuning in. There has been some research on rates of parental stress among pre-transplant populations. And so when we compare rates of parental stress, of parents who have a child waiting for a transplant compared to parents of a healthy child and healthy, I don't love how we always conceptualize those, but a child who is not waiting for transplant or not seeing many specialists outside of their PCP, we see much higher rates of parental stress among the pre-transplant group, specifically in the area of finances, disruption to the family system, and relationships. We also see higher rates of PTSD symptoms, not necessarily PTSD diagnoses, but symptoms, flashbacks, thoughts coming in, to your head when you don't want them to, avoiding places where there may have been a diagnosis made or a critical event when compared to other childhood illness groups, so even compared to parents of a child with sickle cell disease, HIV, etc. And I think it's important to acknowledge that we see this distress both in mothers and fathers. And while a lot less work has been done with fathers, the limited research that has been done shows that both parents are experiencing a lot of distress. It's often to different areas. So for example, fathers tend to report more distress related to finances compared to mothers, but that's certainly not a sweeping generalization, and have different ways of coping. So internalizing versus externalizing their coping. And some of these you'll see overlap. These are just some of the factors that have been studied in the literature in terms of what contributes to these high rates of parental distress pre-transplant. Guilt being a big one, and I think guilt in so many ways, right? Guilt that missing more events of siblings, guilt that parents are waiting potentially for a donor organ from a child or young person that has died, and parents express guilt around that. This paradox of the severity of illness versus transplant status. So parents will often talk to me about, we know we need a transplant, we know we need a heart, and I know that there's a wait, but I also know that to be the highest status, that means my child is sicker. And so this struggle of kind of living in between those areas. Similarly to our kids, changes in parent and family functioning, relational distress, challenges with sibling care, the wait, the unpredictability of it all, not knowing whether you'll be inpatient or outpatient for a holiday or a birthday or a family wedding. These things, of course, contribute to stress. Again, similarly to our children, the loss of control and independence and privacy that you have as a parent. I always remember this pre-transplant patient I was working with, and the mom told me, this hospital room is my living room, my bathroom, my bedroom, and my kitchen. And, people are constantly in all of these areas of my house, and I have nowhere to go. And so when you are experiencing that distress in an environment such as the hospital, that can certainly increase distress. And then financial stressors, employment stressors, whether or not your job is supportive or not. For some families, relocating to be closer to a transplant center. These are really, really significant stressors. And so normal that our parents are feeling that and reporting that. And then siblings, I've talked about them a lot in terms of how that impacts our patients and parents. Unfortunately, very, very few studies have been done on siblings, and I think it's an important group that we need to think more about. We see about 25% of siblings pre-transplant with emotional and behavioral problems, but I couch this in the fact that there's much more research to do. And so slightly higher risk than what we see in our general population, but again, 1 in 4, so something we need to be paying attention to. Post-transplant, there's been more work, although we have lots more work to do, but we've got many more studies post-transplant. And so when we look at the heart and lung research, we see about similar rates. 20 to 50% of our post-transplant heart and lung patients, pediatric patients, with clinically significant symptoms of depression, anxiety, behavioral or adjustment systems. I recognize that this is a big range, 20 to 50%. I would say the majority of the research suggests about a third, so somewhere between 30 and 35%. Recent work that we've done here at the University of Michigan shows about 33% of our patients with clinically significant mental health conditions. And much of this work has been done many years post-transplant. So we're seeing some of these problems persist 5-6 years after transplantation. And then compared to the pre-transplant kidney data, we see a decrease post-transplant with our kidney and liver mental health. So 20% with clinically significant depression, anxiety, behavioral or adjustment systems. So much more in line post-transplant for our kidney and liver populations to the general pediatric population. And then there has been some work specifically on post-traumatic stress in pediatric post-transplant patients, with about 15 to 30% of our pediatric post-transplant patients reporting post-traumatic stress symptoms. So again, not to the level of meeting criteria for a PTSD diagnosis, but having these flashbacks or these reoccurrences or nightmares or wanting to avoid certain places or certain situations. I also want to really acknowledge youth adherence as part of this talk. Non-adherence to the medication or treatment regimen is very, very common among pediatric solid organ transplant recipients, far too common. So rates of 50 to 70% of our pediatric transplant patients of not taking a medication correctly or adhering to their medical regimen. And these numbers shock parents and shock healthcare providers when we give this data, but it's certainly an area where we need to be spending more time and attention. It's specifically higher in our adolescent population. So when we compare to adults who are post-transplant, we see that non-adherence is actually 4 times higher in our adolescent patients, which we will talk about when we get to kind of strategies. And so as a psychologist, I'm always really interested in, well, what is associated with these mental health conditions or with non-adherence, and which of these factors can we modify? So there's some things that we can't change. I can't change, how sick a child may be pre-transplant. I can't change cognitive functioning post-transplant. So it's helpful to kind of understand what the risk factors are and where we may be able to make intervention. So what we know is associated with non-adherence, specifically in our solid organ transplant recipients, is older child age, so those adolescence years, poor mental health functioning. So our patients with higher rates of depression or anxiety, for example, are more likely to have non-adherence issues, limited medication knowledge, so not understanding their treatment regimen, executive functioning challenges. Executive functioning is our manager of our brain. It helps us with problem solving. It helps us with organizing. And so kids who have some executive functioning challenges, which can be common with some childhood diseases that lead to transplantation, is associated with non-adherence. And then we know that in family systems where there's greater parent distress or family conflict, that is also associated with non-adherence. So things that we can be thinking about when we're looking at who in our clinics may be more at risk, or at what time do you really need to be thinking about this as a parent, and talking about some of these areas as well. Post-transplant parental psychological functioning has also been studied more frequently than pre-transplant, and so I've been able to summarize across all organ groups what we see. We do see higher rates of mental health conditions, specifically depression, post-transplant in parents. We see these persisting high rates of PTSD symptoms, with about 50% of parents reporting post-traumatic stress symptoms post-transplant. And I want to pay special attention to parent and caregiver mental health as part of this talk today, although I know many of you are tuning in because you want to know how to best help your child or your teenager or your young adult. But you can see here that parental mental health and coping is really important in terms of child health outcomes. And so research has actually established associations between parental and family coping and mental health with child emotional and behavioral functioning, with medication adherence, as we discussed, with readiness for hospital discharge, and with number of hospitalizations. And so when we get to talking about how to help parents cope, usually this is where I can convince parents that that's important, is that your coping will impact your child's health and mental health outcomes. And so amidst the many things that you are trying to fit into your schedule and your day, this is an important thing. Your self-care is important. All right, so as promised, I wanted to spend the majority of our time talking through some tips and strategies that you can actually use with your children and teens. And so starting off with really preparing yourself, I use this metaphor with parents I work with a lot, that when you're on an airplane and they say, you know, please put your oxygen mask on before assisting others. As a parent, I don't know that I would ever listen to that myself either, but we understand what they're saying, right? If we are unable to function appropriately, we're unable to help our child. And so, you know, I think this is an important thing to keep in mind in terms of honestly evaluating your own mental health, your own coping, your own anxiety, and seeking that help and support when you need it. I also often tell my parents about this study. It's older, it's from the mid-1990s, but we found that parental anxiety during medical procedures accounted for more than half of child anxiety, child response to the medical procedure. And so, you know, while child life and music therapy and psychology and all of us may be able to come in and provide interventions, really most often children are looking to, how is my mom handling this? How is my dad handling this, as a sign for how scared or worried they should be. So another important reason why self-care is really important for parents. Secondly, I would say we need to consider the developmental stage. So what is kind of normal across childhood development? So in toddlerhood, things that we would see pre, post-transplant, or even before all of this starts, is that there's a fear of being away from parents. With medical illness, children may regress developmentally, so changes in toileting, changes in sleep behaviors, changes in ability to feed themselves, etc. That would be considered normal when going through a stressor like this. Difficulty sitting still, of course. Toddlers may conceptualize illness as a punishment, so getting a poke as being a punishment. They're very concrete in their thinking, and as we talked about with the last slide, they're going to look to their parents and caregivers and those around them, especially for how to respond. And so, you know, if they see the fear when they're about to get a PICC line, dressing change in parents, then they are going to imitate that fear. In childhood, magical thinking is really common. They begin to understand their bodies more and how they work, although have lots of learning to do. I will say that one of the most common questions I have in childhood around transplant is, well, if my donor is a girl, will that mean I'll become a girl? They're very kind of concrete in trying to understand how their body works. And sometimes parents are just a bit shocked by the questions their child asks, but they're trying to figure this all out still. They regularly fear separation from their parents, needles, and often just focused on this idea of being cut and some of the obsession around surgical procedures. And they're striving to develop mastery over their environment. So needing that control, and especially when there's so little opportunities for control when chronically ill. And then in the adolescence years, adolescents are trying to develop autonomy and control. So struggling with this loss of autonomy and control is very common. Social relationships, perceptions of how others view them socially, and embarrassment are common challenges among adolescents, and a need for privacy, of course, which we've talked about. But it's normal in adolescence for teenagers to struggle with these issues. So supporting your child, I think it's always helpful to normalize and validate their questions, their concerns, and their feelings. And so what I often do when working with a patient is say, you know, a lot of patients I work with sometimes wonder about, or sometimes ask about X. Do you ever think about that? And so as a parent, you can also ask that question. You know, I sometimes wonder about this, and I wonder if you ever think about it. And they may say, no, that's a silly question. Or they may say, yeah, actually I do. And they realize now that they're not weird in their thinking, or they're not the only ones who's been thinking about that. So just normalizing their curiosity is helpful. Similarly, we want to normalize their feelings, their worries, and their experiences, but it's really important to not ruminate or provide over reassurance. So, saying to your child, I feel sad sometimes when I think about spending Christmas in the hospital, but it helps me to watch my favorite movie when I'm feeling sad. And so letting them know that, yeah, I have these feelings sometimes too, and that's normal, but we certainly don't want to kind of dive into it too much with them. I worry about your surgery next week too, but I know that the doctors will take such great care of you. I do want to say that teenagers and young adults will sometimes get upset, though, if we take this too far, when we say, I know how you feel, because they'll say, no, you don't, right? You may be here with me, you may be walking this journey with me, but you don't know how I feel. And so I tend to say, I don't know exactly what it feels like to be post-transplant with rejection, but I really care about how you are feeling about this. And so I think that can be a helpful line for parents as well, when you're expressing the fact that you understand, you have empathy, you have sympathy, but not claiming to be entirely in their shoes, because I think our teenagers and young adults can be especially sensitive to that. The reassurance piece, I want to tell you about a study that was done. I cite this often with parents, but they had 3 groups of children and parents, and they assigned them to different conditions. One was parents providing over reassurance to their child. So everything's going to be okay. It's going to be fine. This isn't going to be that big of a deal. You won't be in the hospital that long. One was distraction. So when the child started to show some worry, parents would distract with a movie, an iPad, a game. And the other was a control group. They told the parents nothing, kind of said, act as you would. Interestingly, in the study, the group with the over reassurance were the children that were most distressed. The active distraction group was least distressed, and the control group was in the middle. So I can appreciate that it is natural for all of us to want to provide over reassurance, but we have to be careful, because I think that it can make kids feel more isolated. And they often are smart and understand these things better than we may give them credit to. And so when we're providing over reassurance, patients will say they feel like we're hiding things. And that can actually be more scary than the truth. So we want to balance our comfort and reassurance with validation and honesty, which can be certainly hard to do. So some suggestions. These are things that I use in my clinical practice. A worry box. We'll often make these with patients. They can decorate them however they'd like. And how we'll use this is, especially for the really curious kids or the really anxious kids, we say, okay, if you have a worry or you have a thought or a question, write it down. Put it in the worry box, we'll lock it up, and once a day or once every other day, we have a 15-minute scheduled time where they sit down with mom or dad or a therapist or a grandparent, and they go through whatever worries they put in that box. And you talk through them, and you answer their questions, and you validate those experiences, but you keep it to a limited time. And so it's not taking over an entire day, and end with some type of positive activity to distract with. Kids find this to be really helpful, and I see in my practice that the number of worries that go into the box, or the number of questions that go into the box, decrease significantly over time. So it may be 8 questions day 1, and then a couple of days later it's 2, and eventually they say, oh, we don't even use that anymore. And so we're trying to get that balance between validation and talking about worries while not having rumination, which can occur all day. And that's where we get concerned about more serious anxiety. Of course, diaphragmatic or belly breathing or deep breaths. I think that the more that you can bring fun things into it, whether it's pinwheels, bubbles, etc., that can be helpful for kids. We often encourage deep breathing, but it's hard to do during moments of acute distress. When we tell kids to deep breathe during procedures, about 65% of them refuse to do it. And so deep breathing is something we have to all practice. And I find that when we're able to use special pinwheels or things like that, it can help actually focus their attention. The postcard is one of my favorite strategies that I use with patients, and certainly something you could do at home as well. I will have kids write a story, draw a picture of a favorite memory, a favorite trip, a dream they have, a wish for something that they want to be. And then when they go to the blood draw lab or they come for a procedure, they bring this postcard along and tell the lab technician about their story. And so this is another way that we're bringing active distraction to coping, which is really, really effective when we're working with anxiety, particularly in a transplant patient. So that is a fun one that we use. Some others, and I understand that these are more targeted towards younger and middle childhood, and we can, during questions and discussion, certainly talk about some ideas for adolescents as well. This drawing on the, well, let's see what side, the game board with the cat. This is a procedural plan for a PICC dressing change that I worked on with a patient. So something you can do at home when you're preparing for a procedure with your child. This is giving them some control over the situation. And so we made a game board, a Minecraft game board, his favorite game, and went through all of the steps, both those that we needed to do medically to complete the procedure, but also ones where he had control. So where he would sit, how much time he would have in between, what arm or what type of cleaning solution, the white wipes versus the orange wipes. And so giving some choices there. You can see that we also put coping skills in, so playing I Spy when the PICC area was drying, which was a particularly distressing time. And then at the end of the game, you know, a prize was had, so that was playing Legos with myself or with a parent or one of our child life specialists, a fun activity at the end. And so oftentimes with our youngest and middle childhood aged children, we'll do game boards. It gives them some control and it gives them some understanding of what to expect throughout the procedure. You'll see here our child life specialist had also done some medical play and prep with the cat getting the PICC line. The chains I do use with my teenagers more, and this is based upon the idea of generating positive self-statements or positive self-thoughts. And so what I will do for hospitalized patients and those that are home is it can be very easy to be weighed down by many of the negative news we hear throughout the day, or the bad pieces, missing a homecoming dance, or you know, a friend didn't call to check in today. And so what we try to do is pick one thing a day or one thing every other day that did go well. A lab value came back okay, or I got to have lunch outside, or a friend called and asked me how I was doing. I went to school and I was able to stay in school all day. And we make this chain of kind of positive things that happen. And we know from research on depression that even amidst kind of bad news and bad situations in our life, if we're able to focus on something positive occurring in our day, it can be really helpful for kind of resetting ourselves. And then I've got this picture board here. This is more specific to the hospital environment, but when we can implement daily schedules, and again, doing this across all ages, it can be really helpful. We want to keep patients on good sleep routines. That's really important for both mental and physical health. And so having daily schedules, again, this is giving some of that control back. It's giving some of that independence back. It's giving, in a really unpredictable situation, some predictability, although in a hospital setting that can change to their day. So I'm going to sleep until this time, and then I'm going to have an hour to, you know, watch a TV show and eat my breakfast, and then PT/OT is scheduled, and we build in fun things, pizza parties, movies, etc. And so daily schedules, I think, are really important when in the hospital across all pre- and post-transplant populations. And then discussing difficult topics. This is a question that parents often, we often talk about. These are just some of the difficult topics that parents of my heart population have said that they struggle with at times. And what do I say when they ask this? I wanna, put this in the position that there's not a one-size-fits-all approach, and each child is different, each question is different, each situation is different. And so while I'm going to give some tips, I appreciate that there's not a one-size-fits-all. So the ask, tell, ask approach is, again, something I use as a psychologist, but certainly something as parents we can use, so asking them, well, what do you understand about your kidney disease? Do you have any worries about it? What worries do you have? Is there anything you want to talk about? And if they say yes, then you tell them that information. If they say no, then you say, okay, well, I may ask you again, or you can come to me if you have those questions. So then giving them the information that they ask for and confirming their understanding. So I told you a lot, or we talked about a lot. What did you hear from what I said? Giving them an opportunity to ask any questions. I will say most kids will have a question or two, and then they'll feel pretty satisfied and move on from there. We want to always provide a developmentally appropriate explanation for things. If we're thinking about a procedure, specifically a surgery, transplantation, what they may hear, feel, smell, taste, touch, so all of the senses. Visual materials can be helpful for kids in showing medical equipment. So actually showing a VAD device, actually showing what a catheter looks like. That can be very helpful. Parents will ask me too, when do I tell them? When do I tell them that they have a cath coming up? Or when do I tell them that they're going for a fistula for our kids on dialysis? And so again, I don't know that we have this perfectly understood. The limited work that's been done in this area is that for kids and teens, around a week or so or more, definitely for our teenagers, I would say more, but for young kids, just 1 or 2 days before the procedure. And that's because, again, we want to be honest with them, but we don't want to give so much time that we're overwhelming them with these ruminative and worry thoughts. And so kind of finding the right balance between honesty and overwhelming. We want to use simple and honest language with limited medical jargon, which as parents, I'm sure you don't have that challenge as much as our healthcare providers may. And if asked a question you don't know, that's okay. So, a popular one is, well, when are we going to go home? Or when are we going to get a transplant? And I think we all know that we don't always know the answer to those questions. Certainly, we can't predict when we're going to get a transplant. But if hospitalized and they say, well, when do we get to go home? My recommendation tends to be that we focus on things that need to be done for discharge as opposed to a date and time frame. As we all know, that can change. So, saying, I don't know for sure. I don't think the doctors know for sure. I do know that we need to have the medications delivered. We need to finish our teaching about your new heart. And we need to have this tube out, or we have to, have your lab levels. And so, there might be more things, but we could put these on the board and know that if we're checking these things off, we're getting closer to going home. And so honesty and giving them some type of thing to look forward to, I think, can be helpful. And then the prognostic information. This, of course, is a tough question for parents and healthcare providers. And so I feel really strongly, we're doing research on this with adolescents and young adults, but honesty is really, really important. And even in our youngest kids, research has shown that they often have an idea of these things, even when we have not told them. And thinking about how scary and how isolating that can be when you're not getting the truth and you're just figuring out these answers in your head as a 7, 8, 12-year-old. And so I will encourage parents to say, we don't know for certain. They've told us this, but we can hope for so much more. Children are surprisingly pretty responsive to that question, and I think they feel validated in their worries when parents respond like that. this is a huge passion area of mine, and so we have a big NIH study underway right now looking at how we talk about difficult topics in our advanced heart disease population. But I just want to show you guys this study. This was with 12 teenagers and young adults, ages 12 to 19 actually, although we allowed patients up to 24 years. And they were all talking about transplant or listed for transplant. We actually didn't have any post-heart transplant patients in the study. And when we asked the patients themselves, do you want to talk about these things? The dark blue is yes, I definitely want to talk about it. The light blue is I don't know, maybe, maybe not, kind of depends. And the yellow is no, I definitely don't. And you can see here, these are tough things: treatment side effects, details of procedures, decision-making, impact on activities of daily living, prognosis, and end-of-life care. And overall, 50% or greater of our adolescents and young adults were saying, yes, I definitely want to talk about that, with a number of others saying, I might want to, and few saying, no, I definitely don't. And so this was really informative research to us as healthcare providers, but also parents were surprised to learn that these were their child's preferences. So lastly, getting extra help. I hope that these strategies are helpful, that you can use them yourselves and in your own homes, but mental health care can be extremely important as well. So when do we get extra help? I would say if your child is pre or post-transplant, anytime is certainly okay. This is a huge stressor, and getting support from a mental health professional at any time would certainly be valid. But if you have worry about your child's mood, anxiety, or behavior impacting an area of functioning. So you're starting to notice that they've missed a med or two, or they're saying they don't want to take their meds. Their school grades are changing, their relationships are changing, their sleep habits are changing. These would be times where we would be more concerned, and we would want to certainly get mental health care involved. And then at any time, if you're concerned about your child's safety, of course, if they're making comments like, this isn't worth it, or I don't know what's the point, or those would be times when we would want an assessment by a mental health care professional. How to find a mental health care provider. Your transplant program should be a first stop for sure. While you may not have a transplant psychologist, oftentimes there's child psychologists within your children's hospital setting, and hopefully they can help point you there. Pediatrician and primary care may also have referrals for your area. You can contact your insurance company, although they may have less idea of people kind of specialized in this area. And then, of course, parent and family groups and networks like CCF and Transplant Families. Those are great resources for, has anyone, worked with anyone in this area specifically with a kid with transplant. And then what to look for. I would encourage you to ask for a psychologist or for a therapist who is specialized in behavioral or cognitive behavioral therapy. This is really the gold standard treatment for most childhood emotional and behavioral disorders. And so we want to make sure that they're getting evidence-based treatment. And personality fit is key. I tell patients that it's like shoe shopping. This is really where you have to have a good fit. It has to be someone that you like and that you feel comfortable with. And so it may take trying on a few pairs of shoes before you find the right fit. And so that is important. Some references, and then of course time for some questions and discussion. Thank you all.
Thank you so much, Dr. Casino. That was incredibly informative and very helpful. So thank you so much. We really appreciate it. So we do have a couple questions in the queue, and we'll get started with those. So if anyone else listening wants to submit a question, go ahead and do so now. We have about 10 minutes to answer some questions. So the first question to get us started is, when a child is upset at a particularly invasive procedure, how do we validate their feelings while keeping them calm for what needs to be done?
Sure. So, I think we can say that this is this is hard. We know that this is uncomfortable for you. It helps to like helps to do X, Y, and Z. This is where I think it's important to prep for these procedures. And so I know that we always can't do that. You know, sometimes we have to have something placed or something done, but as much as possible, having a plan going into a dressing change, going into a poke. And then, so we want to validate, we want to tell them that we understand it's hard. I think it is most upsetting to kids when we tell them it's not going to hurt, because it does. Even a blood draw hurts. So we want to tell them we understand this hurts, but this is important for your heart to do this. How can we help you? And moving them along. We want to be careful not to stall too much. That certainly makes the anxiety build. So while we want to give them control, stalling can make things worse. So what I will do is set a timer. I'll say, okay, we're going to take 30 seconds to take a break. But when this timer goes off, then we need to start doing this again. And so helping to keep that distress within a more limited time frame. The more we can move them through it quickly, the more successful of an experience it is for them, which should reduce the distress next time around. But as much as we can prepare ahead of time, I think that's good. Knowing what helps them during those tough procedures and having those supports in place.
Okay, great. Thank you. Another question is, do you know actual divorce rates and self-care for parents during long-term medical difficulties?
I don't. We don't have that data within pediatric transplant. I can say that across pediatric chronic illnesses, the divorce rate is higher than what we see in the general population. Given the many stressors, but I don't have that data specific to transplant.
Okay, thanks. Another question is, do you have any tips for someone who received their transplant in their early teens and is now an adult still struggling to readjust to life post-transplant?
Sure. So, I think that getting connected with a mental health provider could be helpful, and working through what those struggles are specifically. Connecting with peers through peer support groups and others who've been through transplantation shows a lot of benefit, peer interaction with others. So connecting with groups through CCF, through Transplant Families, others with similar experiences. But I would encourage finding that shoe that fits, finding a mental health care provider that can help with some of those adjustment issues would be a great first step.
Okay, thanks. Another one is, do you have any tips or considerations for school-age children for managing the strain that a hospitalization may put on their peer relationships and friendships?
Great question. So I think that as much as we can get school involved in interacting with our child is helpful. So, I often recommend Skype visits, when there's a special event going on at school, as your child is comfortable with it, as you are comfortable with it, setting up a FaceTime visit, setting up something like that. There are institutions where they do a backpack program, which I think is an innovative idea, and sending a backpack to school when your child is out for a long time. That sits at their seat, and it's a place where their peers can drop a letter, drop a note, give a special treat of candy. It helps the kids at school understand that, they're still, they're going to come back, they're just not feeling well, but also gives them that connection to the school environment. So those are some ideas that we use here.
Okay, wonderful, thanks. Another question is, are there any difference in the rates of PTSD and depression in younger children compared to older? In the case of younger children may not have the same recollection or memory of their experience in detail as an older child would?
Yeah, so right, great point. So the data that I'm citing is going to be is most often kind of across age groups, in part because of that small numbers issue we discussed, right? So we don't have huge samples of pre or post-transplant patients. So when people are doing studies, they tend not to narrow the population further by only doing a certain age group. And so those rates are looking at what may be a wide range, 8 to 18, for example. And 8-year-olds and 18-year-olds are very different. So similarly, I can't say this necessarily from the data, but my clinical practice, I can say that the rates of depression are going to be higher among teenagers, and we're going to see anxiety really across the board, although often to different things. So more procedural anxiety in the younger years, and then anxiety related to feeling different, social isolation, et cetera, in the adolescent years. But yes, there is definitely differences, and that data is not fine-tuned enough to separate those out.
Okay, wonderful. Thank you. So that looks like all of our questions. So I just want to take a couple of minutes to close us out, and thank you again so much for spending your time with us today and sharing all of these great tips and resources and information. We really appreciate it. Melissa McQueen, do you want to close us out with any other final thoughts on behalf of transplant families?
Oh, certainly. I want to encourage everyone to be an active part of your medical team by being involved in family-centered rounds when you're inpatient and asking questions in clinic. Engagement certainly helps healing for us as families. I also want to encourage you to share your stories of inspiration and hope with the hashtag Kids Transplant Week. It helps so many of those in any stage of the process. Thank you so much again, Gina and Melissa, for today. It's been a wonderful webinar.
Great, thank you for having me.
Yes, thank you so much. This was great. We have our information up here on the slide now, as we know that there are people who are kind of joining us from different avenues. So for anyone that's interested in learning about more about the Children's Cardiomyopathy Foundation or Transplant Families, our websites are here, and we'd love to connect with you beyond the webinar for any other resources or support that you may be interested in. The webinar today is being recorded, and it will be posted on our CCF YouTube channel. So we'll send out a follow-up email when that's posted so that you can always refer back to it and rewatch it and keep in touch. Thanks again, everybody. Have a wonderful rest of your day. Take care.